Okay.
All right. So, good afternoon, everybody. Hi, Andrea. Thanks for being here today. We are going to talk about the Module 4 assignment, Exploring National Healthcare Quality Initiatives. Can you see the screen okay, Andrea?
I can.
And it's Andrea, right? From if I remember right.
Yes.
Okay.
Yes, that's correct.
So, of course, you can find this by going into your Module 4, into your modules, and then Module 4 assignment. I have it. Let me move this screen over. So I have it up to where we're going to talk about the description and then we're going to dive further into some examples of initiatives that you can use. So of course this assignment is worth 20%, 200 points or 20% of your overall grade, the same as the last assignment. But with this one, the discussions last week and this week we were talking about national healthcare quality initiatives, and some of you guys, well, most of you guys talked about those. And so you guys can utilize the ones you talked about, or we'll find some other ones that you want to talk about. And so what we're doing is we're just going to explore it at the national level. Um, and it says you may already be aware of some national initiatives to improve healthcare quality, but now we're going to research it a little bit more by using our um, Plan, Do, Study, Cycle Act. And then it also references weeks 3 and 4 lectures to help you with an initiative of interest. So you can go back into week 3 lecture, you can bring week 4 lecture into it. So of course the main focus is on course outcome 3, 5, and 7. And of course those are again tied back to the program outcomes. And so instructions, and just bear with me, we'll go over these and then we'll dive into some examples, dive into some links to kind of help you. So what we want you to do is we want you to investigate and thoroughly describe a national healthcare quality initiative. And you're like, wow, that's pretty broad. There's a lot going on out there. There's a lot out there. Um, and this is where sometimes I get students asking me, well, can I use, there's an initiative going on in my clinical setting or the um, area that I'm working, can I utilize that one? And I say, yes, please, because you're actively involved in that. Or if you know that your place of where you work, your place of employment just finished one, you can talk with someone there about, making sure that you can get all the information that you need for your paper. And so it doesn't have to be one that we are going to talk about today. If you already have one in mind at this point, being on Tuesday, you should. If you don't, look through the resources that are provided within the lecture, the resources that we're gonna end with today during this overview, and find one. And if you're questioning, hey, what do you think about this? Text it to me. Let me know who you are, of course. Um, Text it to me, email it to me, say, hey, this is what I'm looking at. What do you think? More than likely, I'll tell you go for it as long as you have all the information needed to be a complete project. So any questions there, Andrea?
No.
Okay. All right. So first of all, we want you to introduce us to the initiative. And you can see here, can you see my arrow on the screen?
Yes.
So there's a couple different things under the introduction. We need you to identify the initiative, including how to locate the information on the initiative. So if this came from a website, make sure you add the website. If it comes from your place of employment, make sure you add where this came from and why you have chosen this initiative to investigate further. So make sure you do those 3 things. And then
Okay.
the next one is we want you to describe the mission and goals. And so here we go with our level 1 headings again, just as we did with the previous paper. You're going to have your introduction. Make sure that you have those 3 items under it. Then you're going to have your level 1 heading, mission and goals, and you're going to discuss those. Next, population of focus, or those served through the work of this initiative, and the stakeholders or members of the interprofessional team involved. So whoever's involved in this, whoever is the Of course, if it's a hospital-based initiative, administration, nurses, physicians, depending on the initiative. And then who is it going to focus on? Is it going to focus on the patients? Is it going to focus on nursing? Um, examples like that. So that would be under that level 1 heading, population of focus. Then you're going to do your plan, do, study, act cycle, the PDSA. And underneath each one of these, there are specific items that you need to discuss. So again, these are going to be level 1 headings: your plan, your do, your study, and your act. And you're like, well, I don't know what the plan is. Well, the plan here, you have 4 different things to capture. Underneath the plan, you have to describe the measure. And then this is where you're going to bring in your scholarly evidence presented in the initiative that shows a needs for improvement. This is where you may not, most of the initiatives will have their own research and dive into those those resources. But if you're using one from a hospital-based or a clinical-based, this is where you're going to go out and find your own evidence. And this is where you utilize the LIRN. You talk about home health care initiative, things like that. And I'll bring up a example of what I'm talking about. But this is where under the plan, do, study, act, this is where you're going to have a lot of your citing of your references. Then another one under plan is what data is presented to show a gap between the current and the best practice. Because if they want to change, then something is warranting that change. So what's happening now to where what you want to happen after this. So you need to show that gap. Then what are the proposed quality improvement outcomes? You need to have some outcomes. Could be 1 or 2. More than 1, I would assume. Maybe you only have 2 outcomes. Maybe you have 3, 4, 5. There's no set number on what the outcomes are. Then how does the initiative plan to make a difference in the healthcare quality? How does it make a difference? And so under the plan, you're going to have 1, 2, 3, 4 things written. Now, what I've seen students do is they've put the plan in the level 1 heading, which is centered, bolded, and then the P is capitalized. And then they have a paragraph for number 1, a paragraph for number 2, a paragraph for number 3, and a paragraph for number 4. Or you could have a couple paragraphs for each one. But then that way you're not putting it all into one main paragraph, because then you're going, when you do paragraphs, you're transitioning of ideas. And so you need to have at least 4 paragraphs under that plan. Does that make sense?
Okay. It does.
Okay, just to help with the layout. And it also helps me when I look for these things in your paper. When you have a grader or an instructor who's going to grade your work, you need to guide them on where you expect them to read. If the instructor or who's ever grading, hopefully it's the instructor, and I say that lightly because in my master's program we would grade each other's, and so yeah, it was awesome. I really enjoyed that. You learned a lot about feedback, giving proper feedback, and what it's like to be able to write what you want to say, but you have to be in that positive realm. You know what I mean? And so make sure that you're guiding the person who's going to grade to what you want them to read. That way they're not looking for it. That way it's not going to be missed. And so this is just a way you can format or lay out your paper. So then the next one would be your do. Now there's 2 things under this one. What are the actions being taken by this initiative, and what has been done so far? Okay. Then under the study, how will the outcomes be measured and utilized to refine the initiative? And then who oversees or assesses the action of this initiative? Who oversees it? Could be the healthcare facility that you're working at, could be the American Nurse Association, it could be the Robert Wood Johnson Foundation, whatever initiative you decide to do. And then lastly, we have the act. And so now you need to describe any refinement of the initiative based on the data. Then you need to describe the outcomes achieved so far as a result of this initiative. Now, I've had students tell me, currently we are doing this initiative, but we haven't completed it yet. That's perfectly okay. What has been done thus far? Okay. Who oversees and assesses the action or I mean, under the act so far as a result? So far, this is what's happening. We would hope to project, or we would hope that we're going to see this happen. But as of right now, I do not have that evidence, and that's perfectly okay. Okay, so some students have taken one that's been completely done. Some students are in the midst of doing one, and that's perfectly okay. Just make sure that you let us know. You know, we're not in the final stages yet, but this is what's going on now. But this is what we hope to achieve when this initiative is completed and evaluated. Okay. And then lastly, summarize your paper. And again, include a statement of how nurses can be involved in this initiative. Make sure you don't forget that. So you're going to have what? You're going to have introduction, mission and goals, population, and then your plan, do, study, act cycle, and then your summary. Length 3 to 5 pages, but does not include the title page or the reference page. And then you need to have at least a minimum of 2 current within the past 5 years scholarly resources. Not going to be hard to find. You can utilize the lecture. Okay. You can utilize whatever. Let's say you're going to use the ANA. Of course, you're going to want to reference the website, reference your healthcare facility, or, you know, those are all scholarly. Make sure that you're not Googling websites that have advertisements. Blogs are not scholarly. Marketing tools are not scholarly. Newspapers are not scholarly. Make sure that when you're utilizing the LIRN, that you have that graduation cap in front of any article that you're using, because that's scholarly. Now, I did notice, you know, this last week with grading, a lot of you guys are using blogs. Blogs are opinions. Even though they're written by Nursing World, it's a blog. And there's no peer reference. It's all opinion. When you talk about a blog, you're allowing people just to talk about things and learn from each other, which is great, but it's not scholarly. So make sure that you watch out for those blogs. Okay.
I have one question. If you go back up to the item number 1, when you're saying investigate and thoroughly describe.
Yep.
Does there need to be a paragraph in there for that, or is the writing starting with the introduction?
Well, this is just, the introduction is that.
Okay, so the introduction will include that. Okay. That's what I thought. I just want to make sure.
Yeah,
I didn't.
and that's a great question, because right here, identify the National Healthcare Quality Initiative. That is what you're doing with number 1. So with number 1, I guess number 1 is the outcome of 2, 3, 4, 5, and 6. Because at the end, you're going to investigate and thoroughly describe that. That's what your paper is going to be about.
Okay, got it.
So great. And you know what? That's an improvement that I can make for next time when I teach this class, because that makes perfect sense. It shouldn't be included like that, because number 1 is actually the introduction. Yeah. So I can completely understand where you're coming from on that.
Cool, thank you.
And then, of course, make sure your title page, your citations, and your references are APA formatted. And I would just reach out there again. I know last week was pretty busy with students trying to find a time that worked for them to talk to me one-on-one about APA formatting. When I'm done with this meeting, I utilize a program where I send out a link, and then you click on that link and you see my schedule, and then you can see when I'm open, and you put your name in there, and then it comes to me and it schedules for me.
Oh, nice.
So we don't have to go back and forth 5, 6 times about what works for you. Well, no, that doesn't work for me. And then, of course, last week I was traveling, and so I apologize about that. So I will send that link out, and then click on it. And if you want to talk one-on-one about, I want you to pull up my paper from last week, and I want to go dive into it. Perfectly fine. I will do that. I love APA formatting. Um, I don't mind it one bit. It comes very easy to me now, but it never did until really I was beginning my doctoral studies. It was pretty foreign, but just know that it's part of nursing. It's who we are. It's how we want to be. Um, when you write something, even your nurse's notes, you need to be professional. You want people to read that, whatever you're providing them, and say, wow, she's very intelligent. He's very intelligent. And that's why we're representing the nursing world and we have to be scholarly. And so that's why we keep hounding you guys about proper APA formatting. And I know points aren't a lot. We don't get, 2 points, 3 points, up to 5 points. But after a while, I don't know how much you guys like points being taken off every single time for APA.
Right, right.
Is APA on the NCLEX? No, thank goodness.
Good.
But it's just how you want people to perceive you. Okay.
Okay.
So then next, let's look at the grading rubric. So here we are. You've got the grading rubric. So make sure that you've captured under the introduction, you've captured A, B, and C. If you captured A and not B or C, let's look, you'd get 19 to 17 points. I tend to give more on the higher end, 19. How can I differentiate between 19 and 17? I don't know. I can't differentiate. So, when we have these ranges, you will see that I will tend to give more of the higher range.
Okay.
Now let's say you didn't talk about anything under the introduction, you would get 0 points. Okay. Here's your mission and goals. Again, same thing. Population, make sure that you talk about stakeholders or members of the team involved. Who's the population? Initiative described. Now this comprises 80 points. So, and I've had students not do this section. So that's 80 points right off the top. That's huge.
Yikes.
Yeah, that is huge. And so make sure that you thoroughly, under the plan, make sure that you thoroughly talk about 1, 2, 3, and 4. Okay. Under the do, it talks about 2 different things. Make sure you talk about those 2 different things. The study, make sure you capture everything here and then capture everything with the act. Now, this part I'm very, very, very sticky on. Okay.
Okay.
This is the largest criteria where students miss out because they don't answer thoroughly or they're missing something. Okay. So make sure that you guys should probably spend a lot of time on this section right here. Okay. Then we have summary. One of the main things that students forget again is including a statement of how nurses can be involved. All right. Please don't forget that. Then again, we have your 3 to 5 pages without the title or reference page, a minimum of 2 resources. They have to be scholarly. And then here's your APA. Here's your 80-20 rule. So if you are doing more quoting than you are paraphrasing, then this is where you'll get points taken off as well. Okay. And this is new. This semester. You've seen it on your discussion rubrics and you've also seen it on assignments. So, and it doesn't mean, okay, well, I'm just going to remove the quotation marks. Well, no, because we have plagiarism detection software that will capture that. So please don't just remove the quotations and we won't notice it. We will. Those types of software helps us. And it's good because we need you guys to learn from what you're talking about, because this is only going to help you on the NCLEX. Okay. It's not just busy work. It's work that will help capture the program outcomes, which ultimately talk to the NCLEX.
Okay.
And then rules of grammar. So spelling, punctuation, things like that. And at this stage of the game, I hardly ever take points off for rules of grammar. Okay. So everything is there. So let's dive into, you've read this. Now you're like, I have nowhere to begin. I have no idea. Well, let's go to the lecture. So I'm going to click on modules and we'll just start down here. Sorry if I make you nauseous by scrolling. I'm going to look at the lecture. So this week, and I'm hoping everybody reads the lectures. You know, when we write a course, it takes quite some time to write a lecture. And especially with this course, since we don't have a textbook, we utilize a lot of outside resources. And so it does take some amount of time to write lectures. So I hope you guys are reading lectures and taking notes, because every discussion question or every assignment is found within your lecture material.
Yes, I definitely read them.
Good, great, great, great. So here the lecture talks about National Quality Forum. This is just going to help dive into some initiatives. One area I want to guide you to would be down here. So to learn more about the National Center for Nursing Quality and national initiatives supported by the American Nurses Association, we can visit this site. And so I have brought this site up right here. And so this is the American Nurse Association. And if you look at their site, very, very well laid out. On this page, you're gonna see this right here. But this right here is an example of an effort to improve patient safety using a quality initiative, and it talks about preventing catheter-associated urinary tract infections. So, do you think you can find information out about that? Most definitely.
Oh yeah, for sure.
And this is coming
Wait, so
from.
is that considered a
Yep.
healthcare
Yep.
initiative?
Sure is.
Okay.
Yep. Yep. Well, here, I'm going to click on this. What does this mean? Well, this is just some information. If you want to look at that, it gives you more resources. Quality organizations, list of organizations. Here's all those lists that we talked about in our discussion questions. And I don't know if anybody utilized these or found them on this site, but this is a scholarly site.
Mm-hmm.
Then let's go down into research. So what are some nurse quality research studies? Okay, so these are some studies taken off the National Database of Nursing Quality Indicators. So let's look at relationship between nurse staffing and patient outcomes. That's an initiative. Patient
Mm-hmm.
classification systems, that's an initiative. Okay, it gives you a little bit of review here and here, but then you're going to have to dive in further and look at their research that they give you, which is usually at the bottom of the page, to find out where can I find this information, because it's not all going to be there. You're going to have to look for it. Related resources, let's look at that. I don't know why it always takes me down to the bottom. Research toolkit, that's always fun to look at. And then the impact of nursing care on quality, it takes you to a different white paper. It gives you some different things here. It gives you some, let's see if there's resources at the bottom. Look at all these resources. Okay, that's going to help you. And you can utilize these, just find them in the LIRN and read them. Sometimes the links are active and you can click on those links. Okay, don't reinvent the wheel. If you can find it out there, use it. I'm not saying plagiarize by any means, you know that. But here is the patient-centered outcomes measures. System-centered measures. Wow, look at these. Here's some web addresses for different agencies where they might talk about quality initiatives. There's a lot of information on this ANA website. And that came from just clicking in the lecture.
Okay.
Okay. Quality education resources. Here's where you can find the NDNQI. This is where you can find CUSIN website, might have some quality initiatives there. Okay. Quality and safety, the key is systems thinking. I bet you that's going to have some good information there. Okay. And we got to this by looking at the lecture and clicking this link right here. It brings you right here.
Perfect.
Okay. So that's an example. That's an idea. Let's look down here. Visit the National Database on Nursing Quality Indicators. Well, what does that show me? Okay. So this is a, don't click on the blog, okay, because that's not scholarly. I mean, I'll show you if we click on it, that's a blog. Okay, and you see this right here. If you're going to cite that blog, you see that word blog. No, 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 no.
Okay.
Don't do that, please. Okay. So let's go back. I just want to get out and click on that. So let's see, featured resources. Using holistic care models to promote nurse resilience. Developing and supporting nurse managers or safety and surveillance capacity. Those are all initiatives that are out there. Okay. You can use that. Then, well, what about this one right here? Here's another one. Visit the Center for Medicare and Medicaid Services website and review the quality initiatives. Let's click on, I think I already clicked on those. So here's this CMS one. This is loaded with information. This has a wealth of information. Okay. About quality initiatives right here, it talks about those. Medicare.gov is a scholarly web link. Then let's look through here. Transforming clinical practices, CMS quality strategy, physician quality reporting program, strategic vision. So that's going to give you their plan. That's really going to be a good one for Plan, Do, Study, Act. Post-acute care reform. So down here, related links. This is where, here's a hospital quality initiative, nursing home quality initiative, end-stage renal disease quality initiative, physician quality reporting system, quality improvement organizations. Click on those, see where that brings you. They're full of sorry about that.
It's okay.
I was talking too much. So click on these downloads, see what that brings you. You can each one of these, and so I think physician quality reporting system, I think that's talked about up here. So here's their strategic vision. You can probably get a lot of the mission, the goals out of this one. You can get a lot about the gap, different things that you need for your paper out of this one.
Okay.
Okay.
Sounds good.
Yeah, and then I believe this is the same thing. Yep, okay. Scroll down. Here's your Plan, Do, Study, Act cycle. Okay. There's not a lot of information in this. A lot of students are like, oh my gosh, this is so overwhelming, but it doesn't have to be overwhelming. A lot of the initiatives already do this. You just have to figure out where it's at within their study. Okay.
Okay.
There's another one that I really like, and this is Transforming Care at the Bedside from the IHI. That one is a really good one. Robert Wood Johnson Foundation, Transforming Care at the Bedside framework. That would be a really good one to do as well. So just from the lecture, you have found a wealth of information. If you want to do one of your own, of where you're currently working, please feel free to, as long as you can capture all the information needed. Okay.
I work at a wine bar, so I don't think so.
Well, I don't know. You might be able to study some wine. I'm sure there's wine out there that really helps with writing papers.
Oh, maybe.
Right? You never know. And so let's look at this IHI. And I would guide you to this when you want to talk about the Plan, Do, Study Act. They give you really good insight right here of what is involved in the Plan, Do, Study Act cycle.
Did you
So,
get there from the lecture also?
I got there. Where did
Let's
I get
see.
there?
That's the Institute for.
The IHI. I got there by Googling Plan, Do, Study Act
Okay.
because I knew the IHI uses this in their studies, and this is a is this scholarly?
It
It's a
looks like it. I
it's
don't
a
see any
.org.
ads or anything. And it's
Nope.
a .org, yeah.
And there's no blog in here. Okay. And so what you can do is they have live links, which is awesome. So let's look at what they say about introduction. So how to improve. And so this is when they talk about the plan, forming teams. You're setting your aims, your measures, selecting changes, testing changes. And so this just kind of gives you more of a visual about what you need to write under that Plan, Do, Study Act. It's not
Okay.
going to do it for you, but it's going to give you a visual of what am I trying to capture here? What are they wanting under this? Okay. And so you can look at each one of these setting aims. Well, I want to go further into that. What does that mean to me? Well, here there's safe, effective, patient-centered, timely, efficient, equitable, and you can curtail this or personalize it to your own initiative. This just gives you an idea of what do they want from me in this section, because the lecture, again, if you go back to the lecture, it talks about it right here. Okay, it's an overall method to let us make sure that what we're studying is what we need to be studying, and how science is. How do you start improving something? Well, you have to have a plan, and this is our plan, and under that plan we've got outcomes, and we've got how we're going to measure those outcomes, because if you just bring data into this to it, you've got all these numbers. What are you going to do with those numbers? You have to be able to have a plan on what do those numbers mean to you, and so that's going to help you. So then from that, you're going to do more of that do. So what does that do mean to me? What are we going to do with the data? And then study. So now we have to reach out and we have to find research out there to say that it's evidence based. And then we're going to
Okay.
act on it, and then we're going to evaluate it. And so that's what the Plan, Do, Study, Act cycle is. It's not overwhelming. Please don't be overwhelmed by it. But if you reach out to this IHI and take it even further, that will help you get a visual. Okay.
Okay.
They've given some examples here. Let me go back. Okay, that was the introduction one. So I want to click on the next one. I want to click on forming the team. How do you know who to involve? Who's the population of focus, right?
Mm-hmm.
Here is where they talk to managers, administrators, physicians, pharmacists, nurses, frontline workers, patients. If it's a healthcare quality initiative, I'm pretty sure there's patients tied in somewhere. Who's going to be affected? Not all the time now. In a roundabout way, though, really, because I'm thinking of a nursing initiative, because ultimately, if it affects nurses, the outcome is going to affect our patient care. Wouldn't you think?
Yes.
With every initiative that we do. So examples of effective teams. So then you can go back and you can click on, well, setting the aims. How do I know what objectives to write? What were the objectives? Just make sure they all talk to these areas right here. This is just an example to help you wrap your head around that Plan, Do, Study, Act cycle.
Okay.
Don't shy away from it. 80 points. Dive into it. Figure out what you want to write. And in this section, you're going to have a lot of different drafts. Don't expect just to sit down and write it all in one evening. I think the rest of your paper, you can do the introduction, the mission, the goals, all that stuff. but the largest portion you're going to spend some time on. You're not just
Okay.
going to do it on Sunday.
No, well, yeah,
Yeah.
because I got to work too.
Yeah,
So.
yeah. Life. I mean, you've got life. So here's some aim statements, to kind of help you on what you might want to write or how you want to word them. Okay.
Okay.
Let's see. So let's look at an example. And I know I showed this example before when we did the overview.
Mm-hmm.
Let me try to make it as big as I can. All right, so here you got your APA formatting. Does that look good?
It does.
Yep, make sure the H is lowercase. You've got the title. You've got your name. I took the name out of here. Eagle Gate Nursing 320. You're bringing your title down. Okay, your title has to be brought down to page 1 or page 2. And then you've got your exploring quality initiatives without the running head. Here's the introduction from, where did they get the introduction from? Is that on the grading rubric?
Yes.
Yep. That's a level 1 heading on what we expect to see on the introduction. So let's see, did they introduce us to it? And I highlighted this just so I can see it with my eyes. They're doing the home health quality initiative, which we saw from the, let's see, I believe it's from this one. This one.
Okay.
Okay. Where's my example? No. There it is. Sorry. All right. So here's their introduction. They do have some quotes in here, but they did it right, paragraph 5, and it's only, you go through and make sure that it's only less than 20%. So in their introduction, they've got a nice healthy paragraph, which is fine. Okay. If you can, Andrea, pull up the requirements and let's see if they captured everything that's needed in the introduction.
Let's see. Oh, where'd I closed Canvas by accident.
Oh gosh, sorry.
Oh, it's okay. Where's that going to be here?
Yep. Click on modules and then you'll see under module 4.
There it is. Let's see. So under introduction, identify the National Healthcare Quality Initiative, including how to locate the information on the initiative and why you have chosen this initiative to investigate further.
Okay. So right here is the initiative. They've talked a little bit about this. This has placed an additional qualification on organizations to provide blah, blah, blah. I looked into this organization due to past experiences working in the field. Many instances, I hope to see changes by looking into the Centers for Medicare and Medicaid Services at their home website. So did they capture everything?
I think so, yeah.
Yep. So then mission and goals. So here it talks about Centers for Medicare and Medicaid Services has a set of priority of quality care rather than quantity of care. Institute of IOM. So it just talks about the 6 aims of the IOM and their goal. Okay. Population of focus. Individuals covered by Medicare and Medicaid insurance. And then they could talk more about those patients. Over the age of 65, a little bit more into depth, talked about policymakers, hospitals, healthcare institution. Yep. Okay. Now here's the plan, do, study, act cycle. And you see how they did this? This is excellent way to do it. Here's your level 1 heading. But now they broke it down even further. This is a level 2 heading, flush left, exactly like this.
Oh,
Yep,
okay.
yep, exactly like this. And so under the plan, what does the plan talk about? What's the first one?
Well, I'm sorry, I'm writing down a note.
Okay.
Okay. You just want me to read that?
Just the first one under plan,
Oh, about for the
just to make sure they covered everything.
well, things keep. Oh, there it is. I thought that window closed. Sorry. Like I keep losing stuff. So under the plan, see, describe the measures and scholarly evidence presented within the initiative that shows a need for improvement.
Okay, okay. So right here, you see a lot of quoting, but still, I don't think it would account for over 20%. You just have to be aware of that. But then there's a lot of facts here. And if you have facts, I would expect you to cite a reference. So you see, there's a lot of factual data here.
Mm-hmm.
And this is what you're going to want to see here. Okay. But make
Okay.
sure it's cited. And this is where they use the home, they use the Weaver et al. And home again. So right here, make sure that your quotations don't account for more than 20% of the overall paper, of your whole paper. But
Okay.
this is where you're going to bring that factual data. And when you have factual data, you can't make that up. So it has to be in quotes, right?
Right.
It has to be. But it's not going to be over 20% of your paper, I can guarantee you.
So if it's factual data, you can't paraphrase it
Nope.
or put it in your own words?
No, because you've got these numbers here. You've got
Oh, I
numbers
see.
here.
I see.
Yeah,
Okay.
yeah. And so, like this right here, how did they know that? You just can't paraphrase that number, right?
Right.
So
Right.
it is
Okay.
going to be in quotes. Yeah, yeah,
Okay.
yeah. So then under the do, a lot of planning goes into addressing the needs of patients when they're discharged. They just talked about it more. The goal, you've got many plans put into place. One of their plans, they have initiated our quality improvement organization who seek. So they're just talking about what's under the do part. What's happening now. Study. So this is where you're going to have some more citing of your references. Okay. Here they talk about published findings within the CMS. They talk about this OASIS quality performance information here on the Medicare.gov website. Evidence-based processes of care. This allows consumers. So they've talked about a tremendous amount within their study. And then the act. So what are they going to do? Well, with any process, the first steps are always to gather research to promote change. So how did they do that? They talked about the more significant problems. They talked about once these issues were identified and corrected, there have been many improvements made and implemented. They talked about during the course of the initiative. They talked about the outcome, the rates and decline in hospitalization over 3 or 4 year outcome. So there's a lot of information right there. And then the last was summary. So what they did is they summarized everything and put it into their own words. They did talk about the Plan, Do, Study, Act. Every nurse owes it to their patients to find these ways to improve and find. So there's that statement about
Okay.
how nurses are involved. Okay. So then references. And so this is where they received their information from.
Okay.
Perfect. Okay. So I can send this example out.
Okay.
Okay. Another example that I can bring forward would be this one here. Let me close this one. I can send both of these out. Here is your running head again. Should look exactly like this. Your title, your name, Eagle Gate College. Here's your title brought from your title page. But what's wrong with this title is you don't have
The
to
title
bold
should
the title.
be.
Right. It shouldn't be bolded. And then here's your introduction because that's a level 1 heading. They're talking about the address the nation's deficiencies in the quality of healthcare through the NQF and the IOM. They're bringing IOM into that. Let me see. The IOM agency defined it. So here's the agency. These two definitions are very much in line with each other, and they create a basis for care for. What might be missing though? Why they chose it?
Oh, yeah.
Yeah, yeah. So this one here is missing why is this important to them? You know, is it just because this is the one they chose from the website? Well, just don't tell me that. But why did this one why is this one so specific compared to the one that was underneath of it? You know, why did you choose it? Why do you want it? Why are you doing what you're doing?
Okay.
You have to let me know. And then where they found it. Okay.
Okay.
Mission and goals. So here's some mission stuff and some goal stuff. Okay. Here's the site now. So could I say that they captured that, even though it's not under the introduction? Sure, I could. I would give them credit for that, even though it's not under the introduction. Do you see that?
Wait, where are you looking?
Under mission goals, the site is qualitytoolstm.gov.
Oh, okay.
Okay, so it's right there. Should it be up in the introduction? Sure, it should be. But am I not going to give them points even though it's down here? I'm still going to give them points for that. Okay. Is it better if it's up in here? Sure, because then I know it's not missed.
Right.
But I would have captured it right there. Okay. Its purpose, its mission, population, broad, doesn't stop at one targeted audience, government, policymakers, the only this is great. And here again, they did the plan, do, study, act, cycle, but then they did the level 2 heading under the plan over here.
Okay.
Project goals. Here's the do, working with the FDA. Here's their study. And you see there's more, this is where you're going to want to see a lot of references, citing of references is within this plan, do, study, act cycle. Summary. They summarized it. Let's see if they talked about nurses.
I don't see
Not
that. I
specifically.
mean, not specifically. They talk about healthcare professionals.
Yeah. And I, when it, sure, are nurses part of that healthcare physician, those healthcare professionals? Yes, they are, but specifically talks about nursing. So make sure that you add nursing in here. So I gave you an example of a good one. And I mean, this isn't poor by any means. They would miss some points, but it's very well done. It's just they didn't capture everything that we needed within their paper. Okay. But I think if you can see what's missing, you'll know what to add to make sure that you don't do that. And then this one here, I removed a lot of the references because they were not in APA format, and I just didn't want to even let you see those. Okay.
Okay.
So I'm not going to send out a copy of this one because it's missing some things, but I do want to send out a copy of this one because I think this one is very
And will
well
those
done.
be?
Will
that be under the announcements?
I'll send these out to individuals in an email.
Okay. Okay.
It's going to be in a group email, but you'll see I will send this example out after our meeting.
Okay.
Okay. And then the other thing I do is I wait for this recording to be downloaded, which takes a little while because then I want to get a link and then I have to upload that link into my own YouTube page and then I send that out. So I want to send that out at the same time. So you'll find it here within a couple hours.
Okay.
The link to the recording
I think,
and then the example.
I think that I also want to do Medicare and Medicaid.
Okay. Okay.
Just because there was so much information there within the lecture to do that.
Yep.
And I'll just have to make sure that I write about different things so it doesn't look like I'm copying a paper. You know what I mean?
Right. Yep.
Exactly.
Hone in on one or a couple that really pique your interest. And that's a great, Andrea. That's good for you, um, discussing that, because students will be in your same situation. And
Okay.
so, a lot of you are going to write about the same things, but all the focuses are not going to be the same, though, because you're going to
Okay.
find passion in one area versus somebody else. Okay.
Okay.
But just remember that um, you can utilize any of these, or you can use the ANA website as well.
Okay.
Okay. And where did we find those? All from the lecture.
Yep.
So there shouldn't be anyone that come Sunday say, I just don't know what to do it on. There is plenty to choose from. Choose one that you're passionate about, otherwise it will not be enjoyable to write about. Don't just choose one because it was the first one there and you're hurried. Really plan this out, because again, this is 200 points, 20% of your grade. And so
That's big.
this is, I want to, so then the next big assignment would be your PowerPoint.
Mm-hmm.
Okay. And so I'm just going to dive into that one real quick. This is where 225 points. Okay. And this is where you're examining the quality improvement project or initiative at your work. Ooh, did you just write a paper on a quality initiative? Did you not?
Yep.
Yep. So what are you going to do? You're going to utilize some of that information again to help with your PowerPoint. Don't reinvent the wheel. Okay. There's a little different way that you have to set the slides up, but you can utilize the information that you took from this project to help you initiate the foundation for your next project.
Okay.
There's some different things, targets, benchmarks, different things like that. You have to do a SWOT analysis, and I'll set another meeting up to talk more about this final project. But
Okay.
if you do a really good job on this one, this next project will be a piece of cake. Okay.
Yeah, I struggle with PowerPoint so bad. They take me
Okay.
so long. And it's not because it's just because it's like a computer literacy kind of thing.
Mm-hmm. Mm-hmm. Just
So
pull up PowerPoint, pick a slide theme, doesn't matter. And you've got one slide that's going to talk about your introduction. You've got another slide that's going to talk about your background. Another slide that's going to be research and evidence. Another slide that's your SWOT analysis. Another slide with results. And your last slide, conclusion. And then you're going to
okay.
have a reference slide. So
Okay.
pretty easy. And down here, it talks about creating a PowerPoint presentation with speaker notes, because each slide has to have speaker notes.
Okay.
And then
No, I mean
agreeing
I've
on
done
it.
them and I
Mhm,
can do it. I just
mhm.
don't like it.
Sure,
It's just
sure.
yeah, I just
Well,
struggle with it, that's all.
the thing with PowerPoints is you're putting limited words on each slide, and that's
Right.
hard to do. But what we're helping you with is everything else you want to write, you put under it in a speaker note.
Right.
Boom,
Okay.
you're done. So
So does
limited,
there need to be so there doesn't need to be a title slide, just the introduction?
and that's going to be your um, yeah, you can do a title slide, because you can
Well,
have
just
5 to 7 slides. But you know what?
okay.
You can go over 7. I don't I don't
Okay.
I don't mind.
No,
But
I've had some instructors ask for a title slide and a reference slide, and then
mhm, mhm. And
your
that's all
slides in
part
between.
of, yeah, that's all part of APA. So you're going to have your title, you're going to have your title on your slide, you're going to have your name, you're going to have
Okay.
who you're writing for, just like you would on your title page.
Okay.
And then you're going to have everything else in between, and then you're going to have your reference slide. So
Right.
right
Okay.
here, it says right here, include a title and reference slide.
Got it. Got it.
Yeah,
Okay.
yeah, yeah. So, yep.
Mhm.
Okay. So any questions about Module 4? When is it due?
Nope. It's due on Sunday.
Yes, by 11:59 p.m.
Right.
Late policy goes into effect with assignments. So if you turn it in on Monday, 10% off. Tuesday, 20%, Wednesday, 30%. After Wednesday, per late policy, we cannot accept.
Right.
And that's 200 points that you can't get. I would tell students, if you are struggling with time management and you've got it started, turn in what you have. Turning in what you have is better than taking a 0.
Right. Well, for sure.
Getting 10 points versus 0 points is better than nothing.
Right.
So don't beat yourself up. We know that life happens. Just if you sit down every single day and do a little bit each day, you'll have it done by Sunday.
Right.
But please, as you watch the video, you listen to the video, you have questions that come up, write them down, text me, email me, call me on the phone. I'm available all the time. I work from home. That means my hours aren't from 8 to 5. They are whenever I'm here, whenever a student needs me. And so I would ask you, if it's 11 o'clock at night and you want to see if I'm up, call me. If I don't answer, it means I'm in bed. You're not going to wake me up by calling me because I put my do not disturb on. So I rather have students, because sometimes they're really productive at night, and I am very productive at night. More than likely, I'm going to email you right back, and you're going to be like, "Oh my God, you're awake? Can you talk?" Yes, I can. Okay, that's the flexibility of working from home. You don't work from 8 to 5. You're available all the time, it seems like, and I don't mind that. I don't mind that. I don't mind it at all. So, text me, email me, pick up the phone. Sorry, my dogs are barking.
Oh, no problem.
Pick up the phone and call me. If I don't answer, no big deal. Leave me a message. I will definitely get back with you. I rather visit about this and help the feelings of feeling overwhelmed before I just don't know where to start. I just can't wrap my head around it. Let's help you wrap your head around it because it's worth 200 points, and you wanna submit a good paper. Okay.
Okay.
So any other questions you may have, Andrea?
No, that was
Okay.
really thorough. Thank you so
Great.
much.
Okay. So sometime this evening, look for the recording link and also look for the example.
Okay,
Okay.
perfect.
All right. Thank you.
Thank you.
Okay. Have a good day. Bye-bye.
Bye-bye.
Bye-bye.